Before the COVID-19 pandemic, the concept of the remote patient encounter was a matter of a business decision. Major insurance companies, including those of the government-run programs, were very stringent about appropriating telehealth reimbursement. Before the pandemic, regulations were more rigid, and the medical community was very stagnant in accommodating a remote patient visit to their practices unless there would be a clear financial incentive. Now, 1 year after the coronavirus pandemic and billions of dollars of economic setback, healthcare administrations around the world are ironically promoting remote patient encounters. It seems like a déjà vu, or history is repeating itself. In other words, telehealth would stay a controversial issue if it wasn't for the pandemic. But to the irony, again, the momentum that the administrations are moving telehealth to the market opens another argument. That is when telehealth will fund its legitimate position in the healthcare market, how and at what expense to the patients and medical community. Without a doubt, telehealth brings new benefits to healthcare. But also, carries the new challenges of its own. Meaning, it omits the personal touch and intimate from the clinical encounter. More so, post-pandemic implications of telehealth have added pieces to the already existing puzzles, including but not limited to regulatory and privacy issues, while it is on the fast track to replace the in-person doctor-patient encounter. When we are still struggling to maintain individual information sovereignty, more and more industries, most being non-medical, are trying to tap into telehealth data and information. Telehealth is opening many doors, but not all of those are exclusive to patients' welfare. But why? The COVID-19 coronavirus pandemic has changed the mode of interaction between people. Such an embrace of remote video technology has broadened clinical interactions. It has brought about some changes that may be permanent, from the way healthcare is utilized to the government's reimbursement policies. Telehealth is rumbling in vogue. In comparison, this care delivery model was never intended to have an equal footing with in-person clinical encounters. This response to patients' demands will potentially spur regulatory interactions that will change how independent physicians will practice, but not necessarily in a positive direction: more regulation, more burden, and more frustration. All in all, the current telehealth systems are lacking security, collaboration, proper real-time interactivity, transparency, and most of all, in-person experience. So, let us agree. Patient care is becoming too digital, but current digital health is out of touch with reality. Then again, realty experience is the essence of transparency, collaboration, and patient trust in a doctor-patient relationship. Telehealth is meant to establish continuity of care. But, is it really doing it? Continuity of care demands a robust collaborative logistics to reduce physician burden and optimize patient health. So, what if? We offer you a solution that offers you an in-person experience even when you are connecting remotely. It is secure, interactive, and transparent. Most of all, it offers a physician the capability of performing full-fledged history and physical exam and procedural simulation from a remote location. PX6 Medical Systems is the solution to everything that a telehealth system cannot offer. It improves patient satisfaction and quality of care. It reduces physician burden and overhead expenses, engages patients in their own care, and most of all offers a remote physical exam capability to the clinicians. At PX6 Medical Systems, we don't just raise the bar in quality healthcare. We raise the remote care to a new level.